about what it means to have isolate a patient in a mental health bed today. So Nikki is going to be instructed on how to care for your mental health patient who is isolated with suspected or confirmed COVID-19. So before you go into the room, we've already been through the PPE that you need to wear and how to put it on. You need to think what you need to take with you. You need to do as least visits as possible to this patient, and while you're in with the patient, you need to do everything that needs doing. So we need to think about what we need. We need to take them food and drink, make sure they're eating and drinking. We need to take any medications that are due. We need to take the equipment that we need to do their news score and any physical monitoring such as blood sugars, ECG machine, anything like that that you think would be useful for us to have that information to physically assess our patient. We need to take in entertainment. We need to make sure that they have a way of contacting us outside, either by a call bell or a phone that they can use, so they don't come out of their room. Just to make it really, really clear, if your patient is isolated, they do not come out of their room. They do not come to the dining room. They do not come to the clinic room for medication. And they do not come to the doctor's room for review. They need to stay in that room. They are the source of infection, so we need to keep them in the room. So Nikki has got everything she needs to perform care for this patient. So Nikki, are you ready to go?
Yeah, ready to go. Can I take my visor off?
Visors are risk assessed. So this means, do we really need to wear one? So we need to look at our patient. Are they compliant with isolation? Are they spitting, coughing or sneezing? If you think it is safe to do so, you may remove your visor and go in without it.
They're cooperative.
You may take your visor off, Nikki.
I'll put it in the yellow bag.
So Nikki is now ready to care for her patient. So we're going to give food and fluids and make sure our patient is eating and drinking. We are going to give medication and monitor the effects of that. It is very important to make sure if your patient has suspected or confirmed COVID, they are offered medications such as paracetamol on a regular basis to control any fever. Monitor the effects of this by doing your news score. We would ask that news score is done 4 hourly for these patients, and currently all news protocols is followed as normal as documented on page 2 of the news chart. So therefore, if your patient is scoring a news of 7, you should be think about calling 999 to escalate your concerns quickly, and also advising the ambulance service of your concerns regarding the COVID-19 disease.
Okay, so Nat, the news chart. I can't bring a news chart in, so I obviously make my observations and then document it on the news chart when I'm outside of the room. What about equipment?
Equipment needs to be cleaned when you leave the room. So if you're taking in news monitoring equipment, blood pressure monitor, etc., you need to clean it when you come outside the room.
Okay. What about cleaning the area? What's that expectation?
As a nurse, your responsibility is to make sure that the environment is safe and clean and conducive to patient care. So we need to make sure that the area is clean. We need to be making sure that we wipe down any surfaces with cleaning wipes when we go in and when we leave the room. So when we leave, we need to make sure we're wiping down our door handles and our touch points.
Okay, lovely.
During our visit to the patient in their isolated room, we need to make sure that they are clean and comfortable. We need to offer assistance with personal care, washing, cleaning teeth, having a shave, all the things that we would do normally. We need to support that person to do that if this is required and ensure that they are clean and comfortable in their environment.
Nat, do we use their own stuff, or is it one use only wipes or toothbrushes or what? Or can we have...
I would use their own toiletries if they have them. If not, we have toiletries on the ward that can stay in their room.
Okay.
I would use their own clothes, preferably, if they have them. obviously following the laundry guidelines for washing of any personal laundry.
And I take it anything which does go out of the room would have to be bagged before it goes out of the room.
That is correct, Nikki. Yes.
Okay.
Just to reiterate, we need to make sure that we are doing all these tasks in one visit, therefore ensuring that our PPE stocks last as long as they possibly can to enable us to provide safe patient care.
Okay, so this person has had medication, they are clean, the environment is clean, I've done the news chart and observation. Is there anything else I need to be doing whilst I am here?
Ask the patient how they are. Is there anyone we need to contact for them?
And entertainment, because they're going to be left for quite a while until we next come in with our gear.
And have they got a way, most importantly, of contacting the ward via a call bell or a telephone?
Okay. Okay, and that's everything is done. We need to take our gear off before we go out of the room, except our masks. We leave our masks on. We have our yellow bag to put everything in as we take them off. So, taking off first, we're going to take our gloves off. Hold the middle of your finger, of your hand, and you pull that glove off so it is turning inside out so I am not touching the clean area. I have got that glove in the one hand. With my finger, I touch the clean area under my second glove, pull it over, and then I'll put it in my yellow bag. Next, I take off my apron, I undo the bow, and I stay in the clean area. My hands are in the clean area. I pull my arms out, remaining under my apron. I then fold the apron in so I'm touching only the clean area and take it over my head, and it goes in my yellow bag. If I had eye protection still on, I would be taking my eye protection and putting it in my yellow bag. I then have my yellow bag and I leave the room. When I am outside the room, I will take my mask off, put it in the yellow bag, double up the yellow bag and dispose of it, and then most importantly, wash my hands.